87.7 FM. I'm your host, Zuffar Haq. We're talking your NHS, your health. We're talking this morning particularly, first of all, let me just say, wake up Leicester. If you're like me, we've had the holidays and we're still used to sleeping in like I was this morning. I think we all need to wake up Leicester. Big shout out to hopefully wake everybody up this morning, because we've got a special show today. We're talking about dementia, older people's psychiatry. We've got some real good experts specialists here with me this morning. We're going to be talking about what are the real issues and what are the real symptoms and what we can do about it. So you're listening to Radio Ramadan on 87.7 FM. If you have any questions during the next hour that you want to ask the specialists, please don't hesitate. Give us a call on 0116 4822 086, or you can WhatsApp us a message anytime, 077 488 55055. And this morning we're talking about dementia. So I'm going to introduce my two guests. First of all, I'm going to introduce our consultant, your Deputy Medical Director, Harry Subramaniam, and you are involved in Leicester Partnership Trust, and you specialise in old age psychiatry. Morning to you.
Good morning. Good morning.
And we've also got Kirit, who's an Alzheimer's dementia community champion specialist, and one of the volunteers that does lots of work to help support families.
That's right. Good morning and welcome to the show. Thanks for having us.
Morning. First of all, Harry, you've been a consultant at Leicester Partnership Trust, which is one of the hospitals in Leicester. You're Deputy Medical Director, one of the leading people in research in old age psychiatry. What does that actually mean? What do you do? And why have you ended up in Leicester?
Leicester's home. And I think Leicester's very multicultural, and you get a chance to work with different people of different backgrounds, which enriches and helps us to understand clinical practice better, and also the research elements to address the clinical practice and improve the quality much better. And I think I've sort of come to Leicester and stayed in Leicester. The people of Leicester are very generous. It's really, you can sort of build very easy relationships and sort of develop a lot of forging links. So I've just come and stayed and remained at Leicester.
It's almost formed one community, and I think we've got lots of great specialists, world-leading research is being done in Leicester from across the field, and that's because doctors and most people seem to love the city and its mix.
Oh, absolutely. I think in a way, a lot is made out of huge sort of academic centres in London, but in many ways, Leicester's not far behind at all. We're some of the leading areas in terms of clinical practice, clinical research, innovations, and so it is a good place to be in. There are very skilled consultants, medical professionals, as well as other health professionals in this area.
Excellent. So we're going to be talking about dementia. What is dementia? What is the actual?
Yeah, so dementia is a progressive condition, and essentially a lot of people link and associate it with memory problems or lack of memory or loss of memory. But actually dementia is a bit more than that. What it does, it affects a lot of other, what we would call as brain and mind functions. So the ability to think, the ability to logically think through a problem, solve problems, being able to sort of execute any actions, what we would call in scientific terms as sequencing, which is the ability to decide what needs to be done first, followed by the next sort of ability and so on. So it might start off, or initially might sort of present as very short-term memory problems and repetitiveness, or what we would call as absent-mindedness. But I think as the condition progresses, people lose their ability to speak, their ability to communicate, their ability to understand, follow conversations, maybe pay attention to things. And over a period of time, they start having various problems in sequencing, coordination, awareness of themselves and their surroundings, perhaps get lost, get disorientated, and it progressively sort of gets worse. And over a period of number of years, things can become very advanced, and then people lose the ability to look after themselves or care for themselves.
So you've gone through the whole sort of spectrum there of sort of mild and the extreme versions. And is there a timeline of how long that this goes, or is it different in different people?
It certainly is different for different people. I mean, as a rule of thumb, there are 2 or 3 main broad types of dementia. One of them is what is called as Alzheimer's disease. The nature of Alzheimer's disease is that of a slow progressing condition, and generally, as a rule of thumb, people tend to have Alzheimer's disease for about 7-8 years from the point of diagnosis before inevitably they need a lot more care and support, and perhaps might have to think about more institutional sort of care. There's another type of dementia which is called as vascular dementia, which unfortunately tends to be more common in our sort of Asian background and group. And that's really perhaps because of many what we would call as mini strokes or multiple strokes in the brain. And by definition, they tend to be a bit quicker in terms of progress. And so generally about 3, 4, 5 years, that's a sort of duration. But in clinical practice, more often than not, we get a combination of both of these. So the presentation will vary upon how much the burden is of one condition as opposed to the other.
So basically there's 2 types, Alzheimer's just generally, and which is a lot slower, and then you've got vascular, which is triggered by strokes, which is a lot quicker, and but has the same sort of outcomes roughly as
Yes.
in the direction of travel.
Yes, the direction of travels will probably be similar. I mean, there might be individual differences in the outcomes, and some might perhaps present with more unique and sort of specific sort of areas of challenge. But I think both conditions by definition are of gradually progressive worsening.
Worsening, okay. And you know, I got up this morning. I don't know where I put my glasses, so I stopped and started looking for my glasses. It took me 4 or 5 minutes, 6 minutes looking for my glasses. You know, if you forget things, is that part of this, or can that just be normal?
Forgetting can be can be because of a variety of reasons. If you've got too many things on your mind, then obviously it's very difficult to.
Which I always have. Absolutely. That's my problem. Yes,
absolutely. So I think you always find that if you're busy and you've got sort of multiple things to do, then sometimes not remembering things is not uncommon. But I think it's not just that. I think dementia is a bit more than that. And I think what happens is, although it might initially seem to start off that way, quickly people realize that they have got much more of a problem. They struggle to get their words out right. They sometimes try to replace one word they know what they want to communicate, but actually when they try and say it, one word is replaced by a completely different word. They might know the person that they see in front, but cannot recognize their name. Or they might see somebody in the street who they know for years, but actually cannot tell their name. That obviously becomes a problem.
Yeah. I mean, and some, what are the real symptoms then? Is it just the names and the remembering, or because, some people their memory seems to be really good if they look back 30, 40 years, but their immediate memory just seems to struggle.
Yes, I mean, dementia by definition tends to affect the short-term memory more. And I think that's always the case. And the way to think about this is when you're young and when perhaps your brain is young, you've got a lot of neurochemicals that is needed to form the memory. So as it were, these neurochemicals are the glue that binds your memory. So it's quite easy for them to remember what happened about 30, 40 years ago. And they'll probably be able to remember that in full vivid details. But I think as the brain gets older and the neurochemicals are decreasing, then the glue, as it were, is thinning out. And therefore, the new memories are much more difficult to hold on to. So typically, they'll be able to tell you what they did about 30, 40 years ago. But yesterday, who came and visited them, they can't remember. Or what the instruction that was given yesterday, or the short-term appointments, those sorts of things tend to be a problem.
What can be done about dementia, and what treatments do you have to be able to help people and families? Because this is a real big issue for lots of families, because they're caring for these people, and it must be a challenge.
Indeed. I mean, I think the first important thing to be aware is the recognition. And I think what we know from this particular communities, our communities, is often acts as a bit of a problem. I mean, there are issues of cultural sort of sensitivity, stigma, and so on and so forth. So many families tend to suffer alone, or perhaps they attribute it to just as age, or they attribute it to various other non-scientific sort of reasons. And I think the most important thing first is to recognize that there is an issue.
And seek help.
And seek help.
And seek
indeed.
help.
Absolutely.
Go to your GP
Yes.
and maybe go online and look for the Alzheimer's Association and look for what support is available. Because
yes. I think the most important thing is to seek both formal as well as non-formal help. So I think help from community services, because often they get then the support that is needed for them to be able to take this forward, because often then they realize that they're not alone in this, and there are other groups of people who suffer in the same way, and therefore they get the courage, as it were, to seek more formal help from health services. But yeah, please go to your GP, because there's a lot more we can do about these things today. There certainly are drugs and tablets, and there is good evidence that these tablets and medications slow down the progress. They may not be a cure, but they slow down the progress for a period of about 36 to 48 months. And that is not an insignificant amount of time for people whose abilities are getting compromised.
So it's a huge difference once you get medication. I mean, 3 or 4 years is a good, it is a good lengthy life in comparison if you're quite old, and it will help them support the families as well. So it slows down the process, makes it easier for the families to look after them as well.
Indeed. And I think it's quite easy. More often than not, these medications are single once-a-day dose, so it's not very complex medication regime. It can be available through repeat prescriptions from the GP, so it's quite easy to be on the medication. And I think it tends to slow down. It allows people to be independent in their own homes and their own surroundings for that period of time. And it allows people around them to be able to care for them and sort of deal with any sort of personality changes, etc., that might come as the condition progresses.
And, the condition you're talking about, just generally, do you find that people access the service quick enough for you?
No, I think this has been one of the problems. I mean, there is enough evidence and research to say that access to services by ethnic elders is quite limited, and there are quite a number of challenges. I mean, this is a consistent finding across all over UK. I think we find that ethnic elders often do not access services or access it very late. And by the time they access services, often the intervening period in which meaningful interventions could be done is lost. And so, therefore, the outcomes then tend to be poor. So, I mean, in Leicester, we are relatively fortunate because the ethnic group, in a way, is not a minority group anyway. So I think here we have found that access is not that difficult as compared to certain other areas where the pockets of ethnic elders are very small. Nevertheless, they have a lot of disadvantages in terms of accessing treatment, in terms of the response to medication, in terms of the outcomes, because I think, as I said and alluded to before, our ethnic elders have a lot more other comorbid conditions like diabetes, mini strokes, etc., which makes it more difficult for them to have treatment, and also the treatments produce a lot of side effects. There is some evidence that actually the life expectancy is also slightly poorer in ethnic elders of Asian origin as compared to the white origin. That might be not entirely related to access, but also just the effects of the condition also. So I think it's very important that they seek timely help, because actually, despite all the disadvantages, as I said before, we can probably slow down the progress and provide meaningful quality of life, allowing them to remain sort of fairly active and independent for about 36, 48 months. And that's not an insignificant amount of time in this group.
Yeah, and as you said, if you don't get to see them early enough, they lose that opportunity for the extra 2 or 3 years.
Yes, I think the evidence is the earlier we intervene, the better the outcomes are. So we really want to intervene as early as we can.
Okay, and I'm going to come to you, Kirit. Your Alzheimer's Association, you're one of the champions. What do you actually do, and how do you access, to these people? Because there must be hundreds of people across Leicester and Leicestershire, that, particularly from the Asian community, where people don't actually know that they've got Alzheimer's or dementia. How do we actually try and get those people to engage and try and seek help?
So, thank you. Last year, the Alzheimer's Research UK wanted to do a pilot in Leicester, wanted to look at developing a South Asian Community Dementia Champions programme. So that's basically how we got involved through the charity I run, South Asian Health Action. And it was really to kind of, initially, as the doctors already spoke about, there's a lack of awareness, stigma, taboo, and cultural sensitivity. So having these champions from those communities who speak those languages, who know how to access our communities, we trained them up on over 2 days, and then their task was to go and organise community events to raise awareness. And one of the things that we found was, again, the barriers that exist in terms of people not knowing where to go for, how to get the diagnosis. Secondly, they go to their GP, but the timely factor of getting that diagnosis was also a challenge. And then the third is, there are organisations in the city that we have, but again, people don't know about them. So again, it's navigating how to access community support. So these champions have been great to try and ensure we can advocate for people who've got need that dementia kind of a diagnosis, but also help the families look at navigating and supporting through language-specific support as well as cultural support.
Yeah, because one of the things is I would have thought is if you've got somebody who's elderly in your family and you need to take them to a GP and discuss this, that's going to be difficult. That's a difficult conversation to have with your family member, and it's a difficult sort of situation for you to be in as well. Is there any support, and do you think the GPs are actually doing enough to say, okay, we're open for business, you need to come and see us when you think there's anything wrong? Do you think that doesn't happen? Or
I think the challenge the GPs have is they've got a 5 to 10 minute window of diagnosis and consultation. Now that's not going to be sufficient.
It's not sufficient for dementia, is it?
No, and secondly, then it's getting the consultation with a GP, then getting the referral into the services. The timely factor that takes for somebody to get that diagnosis is a time bomb, basically. Excuse the expression, but the time to get that is delayed, and then that suffers. And one of the things that Doctor did mention, and our communities need to start doing more of, is we're not getting involved in the research. So future drugs, predictions of what could help future generations. If we don't get involved in these clinical trials, in these studies, then we won't help our future generations.
We'll lose out as a community, don't we? Because
Definitely.
it is different. It is different. We are a different community, and illnesses affect us differently because we're Asian, we've ethnic, we've got all the other sort of diabetes and cardiovascular issues that go in the background of that. Harry?
Yeah, I mean, I was going to say, just to add to that point, I think there are problems in being able to access a diagnosis with GPs, but also there are other factors which are very cultural. So some of the assessment tools that are sort of used in common practice here are very Western tools. So they're designed for a population which is very Western. And I think there are problems in translation, there are problems in adapting some of these tools, because I think some of these tools here ask about very anglicized sort of areas which may not be applicable to our patient population. So sometimes the rates of diagnosis can be a little bit sort of hit and miss. And so again, I think there needs to be some particular skill and research into trying to understand what sorts of instruments to use and how to translate some of these evidence into clinical practice. And I think this is where what you said, Zuffar, is very important. We need our communities to come forward and take part in research.
It's really important that the research is done. You're listening to Radio Ramadan on 87.7 FM. The studio number is 0116 4822 WhatsApp messages, you can send them in 077 488 55055. We're talking about dementia. You're listening to Your Health, Your NHS. One of the things that I think people would be worried about out there is how quick do GPs refer these kind of patients to the consultants that work at Leicester Partnership Trust and consultants like you, Harry. Is there a delay, and is that acceptable, that delay at the moment?
Well, sadly, I think we know that we could do far better, both in terms of not just the GPs themselves, but in terms of the memory clinic services too. But I suppose, as with everything else, the NHS faces a lot of challenges in terms of funding and having the staff that are able to deal with this. So I think we do know that, and we do recognize that memory clinics have got a bit of weight. And I think just referring back to what I said earlier, which is the earlier we intervene, the better. I think we know that we still have a way to get in terms of what we want to do to the community. But I suppose, as with everything else, the typical challenges is about being able to have the funding, the staff, the skills, the ability to deliver that on a day-to-day basis. And I think increasingly there is new sort of research which is coming out about drugs that can be given intravenously, etc., to minimize the progress. I mean, it's not licensed yet, but again, for understanding these things, we want the communities to see whether it will be a solution for our sort of patient groups.
And actually might work better because of the ethnic traits that we have as individuals, as a community, that certain drugs might work better on us than some other people.
Yes, we need clinical trials to find that out. And I think this is one of the problems, in the sense that we don't have enough of our patient groups participating in clinical trials to know what sort of factors will be individually sort of better for this group.
And it helps bring out the next generation of medications to treat these illnesses. And at the moment, you're talking 3 to 4 years or 6 years to extend their lives. We could end up where it's actually not going to be a problem for 10 years or 15 years.
Yes, I mean, I think there's a lot of research that is happening all the time. And I think, but yet, I think still there are challenges in translating clinical research into clinical practice. But I expect this will be an area where we'll be seeing many more developments in the next few years.
And Kirit, you were saying earlier that accessing the service and trying to support families, how much more should be done, really?
Yeah, so I think, as I said, there's organisations. You've got the Alzheimer's Society, you've got Age UK, have got specific services. I think we need to have better joined-up services, and also they need to be more involved in the communities and community organisations. Because don't forget, a lot of us as community organisations, we're not commissioned. We do things in goodwill because we know there's a need. So we have to work with those organisations to be more culturally competent and also be able to access our communities. And one key point about research from Alzheimer's Research UK's point of view, they know that their people who come to their clinical trials are not diverse. So hence, they wanted to start this pilot project to raise awareness about the research, but also to have people from the communities to represent them and engage. And we need to look at better service and advocacy. If we've got advocacy support, those communities and those individuals will get better access, timely access, and interventions as needed.
We always think that we're always ahead of the curve, but actually in this area we're behind the curve because we just don't have the people volunteering to become to do the clinical trials, and that's really the research that's required, particularly from our own communities.
Yeah, so I think, bearing in mind, we know there's a reason why people don't access clinical trials. One of the things that we found from our research projects is that they're not aware of them and they haven't been engaged. But also there is a bit of mistrust. We saw that with the vaccinations, with certain communities. So we need these research organisations need to build better relationships and trust with communities, with those individuals. And it's not rocket science. The hospitals have their patients who are going through dementia support. How easy it is for them to then signpost them to research organisations to get them involved and support them.
And you never know, actually, it might lengthen their life. There is a huge positive advantage here, isn't it? It's not negative. The fact that actually, because it is life limiting, that there's a potential that you could actually live for an extra 5 years if that medication actually works for you.
And improve the quality of life. I mean, it's not just longevity, it's about the quality of the life that is then produced with its drugs.
Yeah, so it's a huge difference.
And sadly, one of the things that within our community is common is we wait for something to happen, then we start to do something about it. We need to look at getting better awareness, and prevention is better than cure, as they say.
And unfortunately, that's always been a problem, that our community is very much reactive rather than proactive. And I think we need to change that to become much more proactive and think, okay, how can we get involved in this? Who are the people that we could sort of encourage and support and try and bring in to try and engage with, so that we can actually move things forward, not just on this particular issue, but just generally clinical research across the board. We are far behind the curve in comparison to lots of other communities, and that means long term we will lose out. There's no question about that, is there?
True. I mean, I think, there is poor sort of representation at drug trials, clinical trials, and so on, and we know that. And I think it's an area that we've got to invest better and sort of dedicate more time and resources to widen the participation and have greater involvement.
And we were talking about what can be done to try and improve just generally the risk of getting dementia and other illnesses to do with the mind, because that is because we know that we're susceptible. Asian people are generally susceptible more to diabetes, to heart disease. Is dementia on that list as well now?
Yes, I'm afraid. I mean, I think there are lots of self-help things that we can do, either individually or collectively as a group. And I think the most important thing is to keep active. And I think the most important thing, as with everything else, is the standard sort of advice, which is often good, which is like healthy diet, active exercise. I mean, things like brisk walking, maybe 10, 15 minutes, sort of two or three times a day, is something to keep active. And there is enough evidence that even things like that is very important. Of course, effects of smoking and sort of all of those can have similar sort of problems as with heart disease, and dementia will also have the same issues. So active lifestyle, sort of moderation of any other sort of risk factors, and sort of key active participation, so involvement in groups, daily activities, and even I think the fact that perhaps sort of being more close-knit as a family, spending time with grandchildren, taking part in their activities, doing puzzles, those sorts of things will help.
So actually staying mentally active as well.
Indeed, it's very important to be doing that for a longer term.
I certainly know lots of elderly people who are business people who have stayed in their businesses even till their 80s, late 80s, and it often made me wonder, why are they doing this? But having looked back in retrospect, you think to yourself that actually they've done the right thing, haven't they?
That is true. I think there is enough evidence that sometimes people who've functioned at a very high level and then they suddenly sort of reach a cliff edge and sort of retire and take a more sedentary lifestyle, suddenly they deteriorate much more quicker. So I think it's important to keep going on for longer, albeit you want to slow down and sort of do things much more relaxed in a more relaxed pace and qualitatively a better way. But I think the more longer we can keep active and the longer we can do things, the better the outcome is in the longer term.
Sorry, Kieran, you were going to say something?
Yeah, so part of the training that the dementia champions have received is around brain health. It's about looking at diet, and we've got a specific South Asian diet plate now that's been produced for helping people who prevent them from getting dementia. So that's the key thing. And so when we go out and raise awareness in the community, we do brain exercises, we do diet, we do physical activity. And one of the things that we're trying to appeal for is people from our communities who have been caring for somebody with a loved one, who've gone through, is to share their stories. If we start sharing these stories, we will be able to raise more awareness. So the next program, we are looking to recruit more people to become champions, and that's going to take place in the next few months. So,
is there any sort of contact number or contact email that you can sort of suggest?
So they could WhatsApp the number, which is 07940 516666, and we will get them the application, and we are working with Alzheimer's Research UK to recruit more community champions. We're going to recruit 2 rounds of volunteers in Leicester because it's worked, and we're going to then pilot it in other areas.
And how many community champions do you think you need in a city like Leicester? Because, the community is quite huge, and this problem, unfortunately, is only going to get larger rather than smaller.
Yeah, so we need to ensure we've got a diverse range of community champions from the South Asian community. So, at this moment in time, the last batch of champions recruited were more from the Indian community and more from the Hindu backgrounds. We need to now look at diversifying with the Muslim, with the Pakistani, with the Bangladeshi communities, and the wider South Asian population, because they've got the reach in their own community. So that's who, if we can give them the tools, they will be able to pass that knowledge on.
The demographic mix needs to match the city, doesn't it, basically?
Totally.
Without that, it's not going to work. Is there any particular foods that are really good for, you mentioned you had a plate. I know it was Ramadan, we're all hungry, but, is there any particular foods that are really good?
So what we've, there used to be the Eat Well plate, which was the NHS produced. What we've done it according to the South Asian context. So in terms of more of the greens, more of our vegetables, dals, those kind of, eating well. Also cutting out on, if you're going to have bread, then keep eating wholemeal. And same with chapatis. If we're looking at chapati, the brown,
the wholemeal flour instead of the white flour, and fruits. Yeah. Because the problem is that we're in the cost of living crisis. People are struggling out there, but it's the basics that you want them to go back to and cut out the probably fried foods and everything else, isn't it?
But as so we're in the month of Ramadan, we get a lot of neighbours giving us lovely foods and samosas.
So, but everything in moderation. So we can have the odd one or 2 samosas, but make sure we have fruit as well together with that.
Or exercise. If you've eaten it, then go and exercise.
Well, I think I can honestly say, if you do 20 rakats of a tarawih, you will have that exercise done. So it's not there is certainly something positive out of having a really late evening prayer. So when we open our fast, we then go to an evening prayer, which is quite long, normally about an hour and a half, where you actually end up doing quite a lot of physical exercise as well in certain ways.
And also the sort of community spirit of getting together with people is very protective, and psychologically it'll benefit well-being as well. So I think the effects of worshipping together, producing the social benefits is equally important.
And actually, it gives you an opportunity to meet up with people who you've not even seen sometimes 6 months, 9 months. I suppose it's better than being in isolation in somebody's house and sitting in the bedroom and just, waiting the clock ticking by.
Indeed. I think there's more and more evidence that I think people who tend to shut themselves and sort of stop interactions, they tend to decline much quicker.
Much quicker, okay. We're looking at, how different is the outcome for the ethnic community in comparison to the white community?
Yeah, I'm afraid the ethnic community is slightly disadvantaged. I think, as we've alluded to before, the increased incidence of conditions like diabetes, heart disease, etc., they add a negative effect to overall life expectancy, but also the possibility of drugs that can be given and exposes to a variety of side effects. So I think there is some evidence that actually sort of ethnic communities, ethnic elders tend to have much more complex problems with sort of multiple illnesses together, which sort of confounds and creates more problems to the outcomes longer term. And generally, the overall life expectancy is also sort of poorer.
And Kirit, when you're talking to people, particularly the families, how do they feel? Because is there the knowledge out there about dementia and Alzheimer's that people think they do know what everything to expect and what the outcomes are?
So luckily, the information that they get is predominantly all in English. So we do have some language challenges, but that's what we're now trying to create our own kind of videos from those communities who can share their awareness about what dementia is, how people can stay active, but also how to support their loved ones. And the message clearly is that there is support available. Don't suffer in silence and reach out. We do need to empower our communities with the knowledge, with the information, so they can, obviously, when they go to their GP, they're well informed, so they can negotiate what support they should be getting. But they can only do that if they're empowered. And I think we've got to utilize, our community organizations, how do we get the message in faith institutions? How do we get in community organizations? We've got summer coming with lots of outdoor events, so we need to be very visible into the events and communities to be able to get that knowledge out there.
And how many more champions are you looking for Alzheimer's? Are you looking to double the number? You've got 15 at the moment.
We're looking at recruiting another 30 more. So
30 more, tripling it almost,
yeah. So because we know it's worked, but we know there was a shortfall in terms of where we need to target and communities we need to engage with. So that's the next stage. And the next program will be running in the summer. So so any of your listeners who would like to get involved, I shared the WhatsApp number, which is 07940 516666, or they can email support@sahauk.org and we will get the information to them.
Thank you very much. Yeah. And Harry, if more people get involved with the clinical research and with the supporting groups, that will make outcomes a huge difference, won't it?
Indeed, I think we will have better knowledge and we'll be better equipped to deal with some of the challenges, which then naturally lends itself for more interventions to be provided.
And do you feel sad that not enough is being done? Do you always push for more and more? Is that what?
Yes,
what drives you?
Yes, we know that there is still quite a lot of unmet needs, and there is a lot more we can do in terms of outcomes, but also the quality and the patient experience. So certainly we think we ought to be putting more effort in that direction.
So there's people out there and you want to get to them as quick as possible and say, actually, we can help you with this.
Yes.
And pursue that. Part of the thing with the NHS is something that I always love about the NHS is we've got so many dedicated people, compassionate, who are caring. And, I think on behalf of the people of Leicester and Leicestershire, can I say thank you to both of you for all the efforts that you put in and the passion that you have to do these things? Because, it's all very well that organisations do it. Everybody can do the minimum amount of their job. But actually, you all go over and beyond, and it's good to see that you actually care, and that you want to try and get those people the access they need.
Thank you, and it's been a really lovely opportunity to be able to directly speak to the patient groups and to this sort of Asian community. So I think I'm sort of greatly indebted. Thank you.
Thank you. Yeah, I just wanted to also add, obviously we've covered dementia and Alzheimer's. There's lots of other parts of the work that you do in particular the mental health issues that people have, elderly people have, what do you actually then do for other issues relating to mental health issues?
Yes, I mean, so
Illnesses, really, isn't it?
yes, I mean, I think there's a lot of other mental illnesses like depression, anxiety, etc., for the elderly as well. And so, I think not everything is dementia. Still, the commonest sort of problem in elderly is depression and not dementia, because I think it's very obviously treatable, and I think it improves the quality of life. So, I think there's a lot more of mental health interventions that can be provided to this group. So just not to attribute everything to dementia, there's quite a lot of anxiety, depressions, and other illnesses that can be treated in this group.
And those, because I noticed quite a few elderly people get very insulated later on in life, and they weren't like that when they were younger. And to try and break that cycle of a downward spiral is really quite difficult.
It is quite difficult, and I think this is where, as I said, I mean, we are fortunate insofar as the ethnic group is much more close-knit, and there's a greater role of the family, and so we need to be exploiting it better in terms of being able to involve others and socialize and get the supportive and social networks in place, which will sort of minimize the extent of somebody locking themselves in.
So, I mean, yeah, because we don't have as many sort of reading clubs or places where elderly people go and socialise with each other. There just isn't that infrastructure in a place like Leicester as much as it needs to be, really.
Yeah.
Whereas if you go back to India, Pakistan and the subcontinent, there is quite a lot of structure for them to go out and meet their friends and actually socialise. Yes. Whereas people struggle in the UK. Is that just because life is so busy and they're reliant on other people to take them, maybe drive the car, or
yeah. I mean, maybe multiple factors too. I mean, I think some of the things to be borne in mind is the generational effects, and I think there have been waves of generations and migration, which sort of comes with its own unique challenges, and therefore sometimes we make the mistake of thinking this as a homogeneous group, and actually there's quite a lot of varying differences between these sorts of populations, and therefore any interventions have got to be very targeted and specific. According to the needs.
According to the needs. Kirit, you were going to say?
Yeah, I think we've got lots of institutions, lots of buildings. I think we just need to better utilise them in terms of offering the social activities, because sometimes that's what it takes. It takes our organisations, our communities to be the champions, and that's the way to do it.
I recently visited a church, and they were doing a diabetes coffee morning, and they had all the patients who had diabetes sitting there enjoying coffee, but just talking about their diabetes and their management. We just need to do more of that within our temples and mosques, don't we, really?
Totally, and certainly we started to do that with cancer, we've been doing it with diabetes and organ and blood donation for many years. I think certainly we'd like to thank you for having us in the programme today, and obviously, we need to do more of these programmes, so that's great. And Dr. Harry and others, see, our community is still reliant on wanting the medical professions to talk to them. So, we've got some really valuable people in our communities who come out and help us raise awareness. So it'll be good to continue that.
Yeah, it'd be great to continue that. And also, there is a strong message to go out to people out there, really, is if you're involved in a mosque committee, if you're involved in a temple committee, try and engage with the communities and try and do these coffee mornings, chai pani or samosas or whatever, fresh fruit in this case, probably that would be a better bet. And organise things so that you can target, sort of do a diabetes morning, do a dementia, and if you need help from the Alzheimer's or from the doctors or from the NHS, you're really willing to help and willing to go out of your way to actually try and support these organisations out there, aren't you?
Definitely.
Yeah, definitely. Indeed.
Because I think we need to all push these things along, because in isolation it's really difficult for lots of families, isn't it?
It is, and I think there is a lot of stigma and cultural barriers, and I think even the fact that seeing a group and knowing that others have got similar problems helps people realise that they're not alone.
Yeah, and actually I've been to one or two of these sort of coffee mornings at different illnesses and different things, and I thought it was really helpful because they end up having their own WhatsApp groups.
Correct.
They end up talking to each other, and they end up being able to support each other, because everybody knows it's so difficult to get hold of a GP or get to your practice nurse. But actually, if you've got people who have had illnesses or the same thing, and you think, oh, can I just ask them a question? and you can have the ability to ask them a question, they will help you relieve that anxiety and the stress by just answering answering the question that you might be really worried about.
It's helpful not only for the patients but also the care.
To talk about it, and they've now got that support to be able to get that comfort in terms of what they've gone through. So we really need to talk more and get these stories out, because that's going to help raise more awareness, but also help get the right support at the right time.
And we were talking about the families that struggle with people who have dementia.
What happens is either for various reasons, usually this is not considered as a part of the NHS sort of health service, and I think the GPs will be able to signpost you to places which will offer them. Perhaps even Alzheimer's Society will have signposts which guide them. There are sort of solicitors who are very specially ratified and sort of accredited to deal with some of these sorts of issues, and they will be able to guide and advise you in the journey.
Yeah, and Kirit, do Alzheimer's, because lots of families would be worried about that, because if there's property involved or assets involved and it gets complicated, and somebody's got Alzheimer's, it becomes difficult, doesn't it?
Yeah, there is a special telephone support. There's also the local Alzheimer's societies have got lots of information that they can share on what to do, and they can signpost again to solicitors, firms that are working with them. So yeah.
Thank you. I just want to say this again. It's a great opportunity for people of Leicester and Leicestershire to have heard both of you speak about Alzheimer's and dementia. Thank you again for all the passion, all the compassion, and all your drive that you have to try and improve the lives of lots of people across Leicester and Leicestershire. And a big thank you on behalf of them, because, thank you for coming along and doing the show, and I really hope that we get lots more people supporting research, and we get a lot more of these coffee mornings or chai pani mornings or whatever we want to do to try and encourage people to come together.
Thank you for having us, and also it's obviously for the listeners, it's Happy Eid for next week, and it's also really good to be on Ramadan again. I always try and help where I can, so thank you again.
Thank you. It's been a pleasure, and wish all the listeners a very happy Eid Mubarak.
Eid Mubarak to everybody in advance.